Welcome back. In the rural heart of Bangladesh, a country with an estimated 150 million people, there's a strong New Zealand link to a small community health initiative. The Kailakuri Health Centre has been providing medical services to the poorest of the poor for many years now, and a vital part of the ongoing success of the centre has been the training of local citizens as medical workers. The clinic is administered by Kiwi doctor Edric Baker, who's lived in Bangladesh for more than 30 years with a passion for serving the poor through his medical expertise. The strong links between the Kailakuri Centre and New Zealand have been maintained over that time through a strong network of supporters, including volunteers who give their time to work at the clinic. The latest Kiwi to head over to Bangladesh is Nadine Vickers, who popped in for a chat just before she headed off on her journey. Nadine, thank you very much for coming in to talk with us today. Now, you spent some time at the Kailakuri Healthcare Centre earlier this year. Tell us, how did you come to find out about the centre?
Well, the first I heard of it was actually back in New Zealand. A friend of mine had heard Edric Baker, the doctor at Kailakuri, speak to them at a missions group. And so she referred me on to the website, and she was really excited about the place. And then a team of us from the church in Chicago were planning a trip to Bangladesh at the start of this year. And as part of that, we organised a visit to Kailakuri to see what it was like.
Right. Now, you, I think, intended only to spend a few days there, but that stretched into 6 weeks. What were your first impressions of Kailakuri? Could you draw us a picture of the area and the people?
Sure. Well, we came in by bus. We took a bus from the capital city, Dhaka, which was about 5 hours. It was a bit scary for the three of us because we didn't exactly know where we were going or where to get off. But after that, we took another small CNG across to the village, and the road was unsealed for the last 50 metres or so and quite cut up. But on arriving there, we were greeted by Edric and some of the team, and we were sat down for a cup of tea, which is what they always do with visitors, so that was lovely. And then we had a wee ceremony, kind of like a marae greeting, where they told us a bit about the project and we introduced ourselves, and they sang us a couple of songs. So that was all really beautiful. And then the next couple of days we spent just having tours around the place and getting to know a bit more about it.
Could you tell us more about the facilities and the services that you offer to the patients in the area?
Sure. I think it was started about 30 years ago with a small dispensary, and it's grown from there into almost a rural hospital. There's an outpatients and inpatients unit, and 90 local staff, mostly that work as paramedics and other health staff. We don't do many surgeries, but a lot of treatment for common illnesses like TB and diabetes and other things. And so, as well as the hospital base, we've also got clinics that go out to different areas each week, and they draw in patients that can't travel as far as Kailakuri.
Right. Yeah. The staff that you mentioned, 90 local staff, how does that training program work? Because I understand that it's a special healthcare model for the poor, by the poor. Could you explain to us how that works?
Yes, it is quite unique. What happened was initially Edric started training up paramedics on the job, and so a lot of them are from local areas and they don't have very high qualifications, and some wouldn't have even passed school certificate level. But he trains them up and they learn while they work, and also alongside that there's a treatment manual that's built up over the years, so that gives a reference for what type of medication needs to be used, etc. And then the senior paramedics do get sent off to courses in a nearby city as well for 6 months, and so they get qualifications from that and they help to train the other staff. Each week they've got a Proshikon training, which is basically staff training that all of them will attend, and that's how they build up their knowledge as well.
Now, tell us about the patients. What kind of services do they get, and do they pay for these services?
Yeah, they do pay a small amount. Firstly, they come in to outpatients registration where they get their blood pressure and temperature and weight taken, and then they'll see a paramedic, and the paramedic will be able to diagnose and give them advice on treatment. And from there, we've got a pharmacy to give out medication, and also there's the inpatient service if they are in need of more comprehensive treatment or minor surgeries or whatever.
And when you go back to Kailakuri for your long stint, what's your role going to be at the centre?
So I'll be working as the English administrator, taking over from another lady called Christine, and that involves a lot of the English communication with outside supporters and donors. So a lot of emails and some funding proposals, things of that sort. And then at the project itself, there's a bit of financial oversight and other admin support, putting together PowerPoints or training up local staff and some of the computer skills.
It's because fundraising is a big part of the income for Kailakuri, isn't it?
Yeah, exactly. It's about 95%. We get 5% from patient fees, but obviously we charge very little because they can't afford any more than that. And so a lot of our income comes either from New Zealand or the States, and so we have to keep up with that.
Now, I understand that there's a special connection between the Bangladeshi community here in New Zealand and some recent positive improvements and progress for the Kailakuri Centre.
Yes, exactly. One of our supporters here, Peter Wilson, got in touch with the Bangladeshi community, and through that we got to know some of the Bangladeshis also living over back in Bangladesh who were interested in the project, and so they've been a huge support. Just a few weeks ago, or a couple of months ago, we had a healthcare conference in Dhaka, and that was funded and supported a lot by these professionals from Dhaka University and others in the business community. So that's been a huge blessing for us.
What challenges are you anticipating going back to Kailakuri?
For me, probably learning the language and just adapting to life in Kailakuri. Also learning the job and what that entails. And I think in Bangladesh you can't sort of plan so much to the extent you can in New Zealand. Everything changes quite quickly. And so you've just got to be able to go with that and make the best of it.
Well, all the best with that. What do your family think of this brave move you're making?
Yeah, they were really supportive because we grew up overseas. Mum and Dad have a bit of an idea of what it's like, and they'll be coming to visit me at some point. So that's great.
Wonderful. Nadine, thank you so much for your time with us.
Thank you.
I was talking there with Nadine Vickers just before she headed off to Bangladesh to work as a volunteer at the Kailakuri Health Centre. And as we mentioned before, the centre is administered by Kiwi doctor Edric Baker, who's been delivering healthcare to the poorest of the poor in Bangladesh for more than 30 years. And if you'd like to know more about the project and maybe add your support, do check out the website, which is kailakuri.com. Again, that's kailakuri.com. And they're also on Facebook as Kailakuri Healthcare Project. Well, that's all we have time for this week. Don't forget that this week's interviews will be posted on youtube.com/EndZoneTonight. And many of our previous stories are on that site as well. So thank you for joining us. We look forward to seeing you again next week. Ka kite. God bless you.